Today we're going to be covering the comprehensive normal adult physical assessment techniques. This is going to be a very detailed assessment to where your patient typically is not going to present with any type of medical condition. The purpose of this is so that you can show us that you know what you are looking for. So today, my name is Matthew Fresquez. I'm a certified flight paramedic, and I have been a registered paramedic here for about 7 years now. And helping me is going to be my niece. This is Caitlin. So starting off, the first thing that we're going to do is elaborate on our scene. So this is going to take place to where my patient, Caitlin, is going to be showing for a normal physical exam. She's got to do a sports physical, okay? So we're going to start by coming off to the side and introducing ourselves to our patient. Hello, my name is Matt. I'm a paramedic. What's your name?
Caitlin.
Hi, Caitlin. Nice to meet you. May I sit down?
Go ahead.
Okay. All right, so the first thing that I can tell you right now is that my patient definitely speaks to me when I approach her. Her facial expression appears to be normal. She seems to be very alert, responding to me very quickly. Her skin color appears to be normal. It's pink, flushed. Her eye contact, she looks at me whenever I speak to her. I would put her estimated weight to be at about 150 pounds, which I would change to, in kilograms, about 70 kilograms. So we do have to put everything into kilograms for these types of assessments. Her work of breathing appears to be normal, and her posture and ease of movement appears to be within normal limits. I'm not seeing any type of slouching, hunching over, or any type of discomfort while she's sitting upright in her chair. As I'm getting close to my patient, I can tell that there's no obvious odors. I would be looking for smells of alcohol, poor hygiene. Her dress appears to be normal, and her grooming appears to be within normal limits for her age group. Okay, so the next thing that we're going to cover is going to be our patient's level of consciousness. The acronym that I use for this is going to be SMOM. So SMOM stands for speech, mood, orientation, and memory. So starting off with my patient's speech quality, when she answered me and told me that she was going to do a sports physical, I could definitely tell that her quality of her speech was normal. The rate at which she spoke to me in was normal. She definitely used appropriate volume. The articulation of her words was appropriate, and the fluency at which she speaks with me is also appropriate. The mood, I can tell that she's sitting upright. She's very responsive to my questions. So I put her mood as upright and energetic. So orientation, so what year is it?
2020.
Okay, and what city are you in?
Albuquerque.
Okay, and what's your full name?
Caitlin Renee Vito.
All right, so you've got she is oriented to person, place, and time, so A&O times 3. Now we're going to assess your short-term and long-term memory. So what was the weather like this morning?
Hot.
Okay, that's correct. And what happened in 9/11?
Terrorists flew into the Twin Towers in New York.
Okay, that's actually correct. So when you're asking these type of questions, again, they do have to be verifiable. All right, Caitlin, the next thing that we're going to do is we're going to move in, and I'm actually going to start taking your vital signs. So I'm going to get your blood pressure, your heart rate, your oxygen. I'm going to ask you a couple of questions, and I'm going to be touching your body. Is this okay with you?
All good.
Okay. So for these types of exams, we're always going to be wanting to wear our PPE. If you are currently watching this when the pandemic is still taking place, you're also going to be wanting to have appropriate eye protection and appropriate face protection, N95 mask, gown, whatever your company designates that you're going to have to wear as appropriate PPE. Okay. So I've got all my equipment over here. And the first thing that we're going to start off with is I'm going to determine my patient's score on ABFU. My patient is A on ABFU, and she has a GCS of 15. So is this term okay for me to use for blood pressure? You always want to ask that because sometimes people have contraindications, especially if they have fistulas or if they have had recent mastectomies. But you always want to get their kind of permission to do these things. You want to move fast through these parts. You want to be done with your vital signs about 8 minutes into your scenario, okay? Remember, we never use the pulse ox to obtain a heart rate. So you will be taking a manual blood pressure. So we're going to obtain a manual blood pressure. We're going to record that. I'm going to obtain my SpO2. Okay, should be anywhere between 94 and 96% for New Mexico. Now for the heart rate, I am going to go ahead and palpate the heart rate at the radial. Now when we get a heart rate, it's no longer just a number. What we're going to be doing is you should be giving me rate, quality, and location. So for palpating it, I usually can count for 15 seconds and I'll multiply that by 4. So we'll start now. Okay, so I can tell that her heart rate is going to be 70, strong and regular at the radial. And now I'm going to go ahead and I'm going to obtain her respiratory rate. You can sometimes distract your patient by getting a radial pulse on the other side when you're really actually counting respirations. But what this does is you're palpating bilaterally too. Okay, her respirations are 1 breath every 4 seconds, so that put her respirators at about 16. If you're ever unsure, obviously you would take place for a full minute. Okay, so now the next thing that we're going to do is check her skin. Just an overall general impression of her skin. It appears to be pink. To touch, it's warm, and just by touching I can tell that it is dry. Okay, so we're going to auscultate general lung sounds at this point under the shirt. So, clear. 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 And clear. Okay. Now we're also going to be placing our patient on the cardiac monitor and a 12-lead if indicated, and also with end-tidal CO2 monitoring. Now, Caitlin, on a scale of 0 to 10, 0 being no pain, 10 being the worst, how would you rate your pain right now? 0. Okay, good. And also keep in mind when you're going to be doing your vital signs with your BGL, it is advisory to take it if you suspect that your patient has an altered level of consciousness, no one diabetic, if they're have any history with ETOH abuse, or have a history of malnutrition. And the last thing, let me take your temperature.
Oh.
98.3. So it does take a little bit of time. All right, and we'll break. So now we're moving on to the actual physical exam part of our assessment. So you introduced, okay, so Caitlin, I'm going to be touching your body right now from head to toe, listening to your lung sounds, checking your eyes. Is it okay if I touch your body?
Yes.
Okay. So the first part of this starts off by assessing the patient's skin. You want to look at the color. You want to see that it's pink, warm, dry. Temperature and condition is included with that. You want to check the turgor. Turgors, when you give it a little bit of a pinch, and it should snap down nice to its normal levels. And then we're also going to look at nail beds. You want to see that they're intact. You want to see if there's any type of hangnails, any redness, swelling, discoloration, abnormal types of odors. The next thing that we're going to do is we're going to move to the head. And this falls in line with doing the head, eyes, ears, nose, and throat, okay? So with the head, you want to start at the scalp. You want to see if there's any lesions, any type of lice, discolorations, lacerations to the skull, abnormal types of growths that might be there. You also want to check the back of the neck to see if there's any cervical spine pain. Okay. You're also going to go ahead and check the skull and the face. So you want to give the forehead a little palpation. You want to do the face, the jaw. You want to give the nose a squeeze, okay? But now what we're going to do is we're going to start with the eyes. So with eyes, you want to do it in this order. Okay, Caitlin, so how many fingers am I holding up?
2.
Okay. What color is your shirt?
Maroon.
All right. So I'm going to check your ocular movement for your eyes, okay? It helps to get down to a patient's level so that they don't feel like you're intimidating them. And this way they can actually see your own face when they're talking to you. Okay, so what I want you to do is follow my finger without moving your head, okay? So you want to come out and up, and you want to kind of do an H pattern, and you're wanting to see if the eyes are moving in unison. All right, and the next thing you can do is the boop test. Boop. And the last thing is you want to check pupils, okay? So Caitlin, go ahead and take off your glasses for me. All right, I'm going to shine a light in your eye. Just look straight at my forehead, okay? So you're looking to see if the pupils are reacting bilaterally. So hers are going to be 3 millimeters reacting to 2 bilaterally. Good, her sclera is nice and white. Her iris appears to be uniform, and her eyes are brown. So you can put your glasses back on. Okay, the next thing we're going to do is looking for the ears. You're checking the external ear for any types of injuries, deformations. I can see that she's got piercings. You're also going to want to check inside the ear for any time of excess drainage. So Caitlin here has bilateral ear piercings. Internal canal is nice and clean. And now you want to check to see if she's hearing. So it's important to say, can you hear on, or you don't want to be like, can you hear this on the left side? What you want to do is just snap your fingers and say, what side?
Right. Left. Well.
Good. Okay, so now we've done head, eyes, ears. The next thing that we're going to do is going to go for the nose. So you want to kind of take a visual look at it. You're checking for any type of septal deviation. I'm going to take a quick look up. So I'm going to shine a light up. So septum seems normal, mucosal is dry. Okay, Caitlin, so we're going to check for air movement in your nose, okay? So take your left hand and plug your left nose. Deep breath. Good. Now repeat with your other side. Good. Okay, so we've got no deformity, good air movement. The next thing we're going to do is assess the mouth. So will you open your mouth for me? Okay, so I note the patient opens up her mouth willingly, so go ahead and close. And now I'm going to check her jaw tension, so you want her to bite down. Good. Okay, open your mouth one more time. And I can see that her mucosal is moist and pink. And the last thing, so you want to get your stethoscope, and you're going to listen for upper airway patency. So you're listening right over the trachea. Deep breath. Good, both sides. Good. Okay. So that's nice and clear. The next thing you're going to want to do is examine the neck. You want to see if there's any presence of jugular vein distension. You want to make sure that the trachea is midline. So moving on to the next chest, the next section, we're moving on to the chest. You want to observe your patient breathing normally. You're checking for symmetrical chest movement, absence of pain with either inspiration or exhalation. So what you do is you're going to start checking, looking at the skin. You want to expose your patient here. We're not going to do that. Okay. So you want to start with the clavicles. Make sure the musculoskeletal system is intact. Run your hand right down the sternum. Okay. And then you want to put your pinkies at the very bottom of the rib cage and ask your patient to take a nice deep breath. You're feeling for any clicks or pops at this point. All right, when taking a deep breath, did you experience any type of pain?
No.
Okay, good. So rib stability is present, and looking at the skin, I didn't see any signs of any open or closed wounds. Okay. So the next thing that we're going to do is this is when we get our full lung sounds. Again, we're going to be doing this on the skin. Okay, so we're going to do this. This is bronchial. Take a deep breath. Good. Clear. Clear. That's bronchial. Going to go under the shirt, but for training, we're going to do this. Bronchiovesicular. Sorry. Bronchiovesicular. Bronchiovesicular. And vesicular. And vesicular. So what we're going to do is start listening to heart tones. You want to be sure to rotate the bell of your stethoscope, okay? So S2 tones, that's your aortic. This is your pulmonic valve. Okay, this is your tricuspid. And then you've got your mitral. Now this location right here is the apex of the heart, and this is where you're actually going to auscultate your S2 sounds best. So while we're down here, what we want to do is obtain our apical pulse. So the way that we do that is we maintain listening at the apex, and then we're going to palpate the carotid artery, and they should match. What you hear should be what you feel, and you want to do both sides if possible. Okay. So now what we're going to do, we do lung sounds both anterior and posteriorly, okay? So we're going to go ahead and ask Caitlin to sit forward for us. All right. And then again, we're going to go under the shirt and on the skin, okay? So deep breath. Bronchial. Bronchiovesicular. Bronchiovesicular. Vesicular. vesicular. Okay. All right, we're going to go in detail about the locations where you're supposed to be auscultating. That's going to follow this video, okay? All right, so while I'm back here, I'm also going to expose the posterior aspect of my patient. I'm going to check to see if there's any open or closed wounds, lift up the shirt. I want to see the size, symmetry, see if there's any types of scars. And you also want to give it some palpation all the way down the back. And you want to be sure to get those flanks also, okay? Okay, so from the back, now that I'm done examining my patient's posterior, we're going to go ahead and move over to the abdomen, okay? So with the abdomen, you want to lift up the shirt, you want to expose, you're checking for the color, any open or closed wounds, you want to see the size, shape, symmetry, you want to see if there's any types of distension, and then we're actually going to be listening to bowel sounds, but just note that this might actually take anywhere between 3 and 6 minutes to obtain appropriate bowel sounds. So for training purposes, you are allowed to say, I would obtain an auscultation of bowel sounds, but it might take up to 6 minutes, okay? The last thing that we're going to do, auscultation always comes before palpation, is I'm going to go ahead and push on my patient's abdomen. Again, very important, you're watching your patient's face at this time. You're looking for any facial grimace. Okay, so if you want to get a little bit more specific, okay, this is going to be where your liver is at. Okay, up here is your splenic area. Okay, if you go down, it's your large intestine. Is there any pain or discomfort?
No.
Okay, this is where your appendix would typically be. Any pain with that?
No.
Okay, good. All right, now we're going to go ahead and move on to the pelvic exam. So the first thing that we're going to do is position our patient appropriately. So can I have you put your feet flat on the ground in front of you? Okay, so just explain to them that you're going to be pushing down, and again, you want to keep facial eye contact. So you're going to push on the pelvis. Any discomfort?
No.
Okay, good. Okay, and you're also going to check for any female, male complications. So for female, have you had any fluid or discharge? Any type of abnormal bleeding that's not normal?
No.
Okay. If it were a male, you would also check about some types of lesions, wounds, rashes, abnormal drainage as well, okay? So now we're going to start with our lower extremity exam. So with your lower extremity exam, you're going to do your femoral pulses first. Okay, you are expected to find these. And now we're going to check the skin, the color, temperature, condition, any open or closed wounds. We're going to go ahead and actually rock some of the bones. You want to be pushing on them. We're going to check the popliteal pulse. We're going to check the patella. All right, you're going to check your tibia and your fibula, medial malleolus. And you would have your patient remove their shoes. You want to get in there and actually see the color of their skin at distal locations, and you can obtain the dorsalis pedal pulse down here on the top of the foot. Repeat, skin, color, temperature, condition, open, closed, wounds, lesions, pain, popliteal pulse, patella is intact, the fib is intact, medial malleolus. Check the color of the toes and check your dorsalis pedal pulse. Okay, the next thing I'm going to do is have you stand up and walk towards me. Just take a few steps and then turn around and you can go back. Okay, I noticed that she has good weight bearing ability. Her gait appears to be normal. So what I want you to do is I'm going to check your range of motion. So I want you to get your right foot and swipe it down your left leg and repeat the other direction. Any pain or discomfort with that? Okay, last thing is put your feet straight out in front of you. Okay, good job. Okay, moving on. We're going to come to the upper extremities. So I've got the humerus. I've got my brachial pulse. It's intact. Radial ulnar. Good. Radial pulse. Okay, squeeze my finger. Good. Other side. Humerus is intact. Brachial pulse. Skin color, temperature, condition. Open, closed wounds is going to be included. Radial pulse. Okay. And then squeeze my fingers, both hands. All right. I want you to bring your arms out in front of you. Bring your arms out to the side. And then over your head. Okay? All right. And that is the completion of how to perform a normal adult physical assessment.